ready to start off hour number 4, and our friend Dr. Francisco Cidral is ready to join us from redrecover.com. And folks, remember, we got a great sale going on right now, 30% off. These wraps are incredibly affordable. Go to redrecover.com right now. And when you talk about Dr. Francisco Cidral, he is an expert in how light energy impacts our health. He also has a master's and a PhD in neuroscience and a postdoctorate in health science. And he specializes in integrative therapies and neurobiology of pain and inflammation. Doc, good afternoon, sir. I hope you are doing well, my friend.
I am. How are you doing?
Very good. Very good. And by the way, if you have any questions, you can start to send them in on the chat board. We already have one already from the get-go. Okay.
Okay.
I guess folks already knew that you were coming on, and they wanted to find out about the red light therapy and when it comes to sciatic nerves. And I know my wife has an issue down her leg with the sciatic nerve. How does red light therapy, can it help folks that are dealing with sciatic nerves?
So that's an interesting question, and that's actually one of the models that I investigated during my master's and my PhD. We studied the effects of low-level light therapy, including red and infrared, on the sciatic nerve. So we're looking at the effects on pain modulation, so decreasing the effects of pain, increasing mobility, and also decreasing the inflammatory markers. We actually drew blood, and then we're looking at the markers in the blood of patients that had sciatic nerve, inflammation. It's very. You have to look at the cause of the problem as well. Sometimes it's like pinching of the nerves, sometimes it's compression of the muscles. So you have to also do interventions that are going to help reduce the cause. But red light therapy applied into the areas where you feel the pain most definitely reduce pain and reduce inflammation.
So we have certain wraps for that then, right?
Well, you can even use
The
the
one for the
the
back, right?
the one
Is
for
that
the back, the multi-purpose wrap, which was actually something that I was going to talk a little bit about today, because
Mhm.
we always talk about treating a disease, treating a problem, treating a pain, treating something when you have a problem, right? But we all know that one of the best benefits of integrative medicines is preventive care, is things that you do before you even develop a specific disease. And I would like to share a protocol with you that you can do using the pads, the multi-purpose pads from Red Recover. And it's very simple, but it makes so much sense when I explain to you uh, the different aspects of the protocol. If you would like, if that's okay, then I would like to share that
Of
with you.
course. Of course. Let's do
So
it. Yeah.
so remember, the first thing to remember is low level light therapy, red and near infrared, is very, very well known to stimulate mitochondria, which is the power cell of, the powerhouse of the cell. It's where the ATP is produced, which is cellular energy. So no matter what type of cell you're treating with red and infrared, you're increasing their metabolism, and you're increasing the chances of the cell to produce more energy. So this is very beneficial, overall. And then you can think about what are the different areas in my body that I can put this pad and use every day to improve my overall health. So a very simple protocol that consists of 3 points every day. You could do the heart. So you just put it on top of the heart. So that, remember, the heart is pumping oxygenated blood to other parts of the body. It increases circulating hormones and other essential substances to all the different parts of your body. It's receiving oxygen per blood and pumping back oxygenation, oxygenated back blood back from the lungs and transporting it to all over the body. So that's a very interesting area for you to use red light. And you can simply put the pad and turn it on. It stays on for 15 minutes. Then you're
Right.
increasing circulation over the whole body. If you do that, and then right after it, you treat the liver. The liver, remember, it's beneath the rib cage and the right upper abdomen area. The liver is the largest solid organ in the body. It removes toxins from all the different tissues. It specializes in metabolism, maintains healthy blood sugar levels, regulates blood clotting, and has hundreds of other vital, very important functions. So if you imagine, number one, heart; number two, liver; number three, treat the stomach area. The stomach is a part that is very, very important, not only for digestion, but this is where the enteric nervous system is located. This is what we call the second brain, because it's an extensive network of neurons that carry the same chemicals that some of the brain parts do. In fact, like 90% of the body's serotonin lies in the gut, and about 50% of the body's dopamine lies in the gut. So this is protocol number one: heart, liver, stomach. Just by the effects of the different areas and the functions, you already know that this is going to be very, very good for your health. So I do this one day. The second day, what I do is kidneys and spleen. So then I have 15 minutes in one kidney, 15 minutes in the other one, 15 minutes in
Right.
the spleen area. The spleen is the upper left side of your abdomen, and it's involved in the immune system. Stores blood, filters blood, makes white cells and antibodies that help fight infection, maintains levels of fluids in your body, and produces all these antibodies against infections. And then the kidneys, they are very good for cleansing blood toxins and transforming waste into urine. So I do number one, one day I do heart, liver, stomach. Number two, kidney, left, right, and the spleen. And then I take one day off, and then I do it again. So if you keep doing this, you're stimulating all different parts of your body, and then you're really preventing a lot of problems that are going to happen before they happen.
Okay. All right. That's really interesting there. So you found out about the sciatic nerves, and then you're finding out about the heart and the kidneys. Now, let me ask you something. When you mention the heart, how about a guy like me that has 5 stents in my arteries? How does that how does that help?
So it's in the heart. No matter if you have surgeries, if you don't have surgeries, the red light therapy is non-invasive. It's very light in terms of defect. It's going to increase the circulation in the area, help with the muscle. If you still have any inflammatory processes or anything like that, it's going to help. So you're not going to have, there's no reports in the literature that this is bad for the heart, even in the case of stents.
Okay. Let's talk a little bit about cholesterol and those kind of things. How does red light therapy possibly help cholesterol levels, or can it?
It's very much what were just talking about. Remember, all these organs, they are involved in decreasing toxins, stimulating the cells, regulating your metabolism, and helping the kidneys, helping cleanse the body of toxins. So if you do this protocol, even before you have any problems, even before you have cholesterol, if you already have it, then you can still do the same protocol. But I was trying to kind of alert the users and the listeners to the importance of preventive care.
Right.
Without,
For sure.
like, look how big this COVID thing was, and we saw that a lot of people got pretty sick, and the people that didn't get very sick were the ones that were taking good care of themselves. They're eating well, they were exercising. So what we can do with this is a protocol that is going to increase your overall health, and kind of protect you against things that are still to come. They're not going to come because of that.
All right. Jay is asking, what is the difference between red light therapy and blue? Is it the same as cold laser therapy?
It's a little bit different. So there are two different questions there. The first one is the blue and the reds. So the difference in between the blue and the reds is the penetration level. The red penetrates a lot more, so you can have more effects like in internal organs and everything else. Blue is very well established for use in dermatology, because it stays more on the surface of your skin. So if you have any skin problems, anything there, it's also very good to help clean infections. Especially in the surface, because it's going to stay, most of the blue light is going to stay a top, and the red is going to penetrate. That's the difference there. The difference between LEDs and lasers is the way that the light is modulated. The in lasers, the photons are collimated. They are straight. It penetrates a little bit more at first. The lasers are a very interesting tool. They're much more expensive, and they should be used under supervision. You have to have somebody to monitor, depending on what you're doing. With the LEDs, you can create actually pads like this one. It's very hard to have this many laser diodes all at once. With the LEDs is much easier, and it's less uh, let me see, that less dangerous in a way, if you say. Does that
Okay.
make sense?
Drago is asking, Big O, could you ask the doctor if I have a hip replacement with titanium implants, can I use red light therapy?
There is no reports in the literature that this is going to be something bad for you if you use red light therapy.
Okay. All right. So yeah, he probably has some pain and discomfort at times, and maybe that will help
Yes. Yes.
alleviate and get the blood flow going. So again, redrecover.com. Right now we got 30% off on the pads. So take advantage. They're incredibly affordable. And now you're going to throw 30% on there. Remember, we've been telling you for months now, with our code Big O, you get 10%. Take advantage right now, 30%. Foxbod is asking, does it work on the lungs? And that's all he asked. But if it
Oh,
works, what if
no,
it
it's
helps
it's
the
it's a
lungs?
very, very interesting question. Like during the peak of COVID, a lot of different universities were doing, or research centers are looking at the effects of red and infrared light therapy for the lungs, actually. And the studies are very, very interesting, and the results are very good. Yes, it works on the lungs. I mean, the lungs has cells, and the cells have mitochondria, and mitochondria increases production of ATP, increases metabolism. So there are some interesting protocols there. There were certain companies showing the reduction of the inflammatory markers. One of the biggest things during the COVID was like the incredible amount of inflammation that it generated. And red light is very good to reduce inflammation. So they were doing a lot of interesting protocols on the lung.
All right. It says Jaffrard is asking, I'm 56 years old. I just bought the universal pad a few weeks ago, and I'm on a
Perfect.
high performance tennis coach and everyday surfer. I have severe shoulder pain and neck pain. What would be the best way to use it for the universal pad?
You have to use it every day. You can use it before your practice, and you can use right after your practice. It's something that if you have the discomfort there, if you have pain, you can use in the same area up to 3 times a day. Then and it's going to help reduce the pain and increase mobility in the area. The other
It
thing that
doesn't,
I that
by the way, Doc, and I hate to interrupt you, but the pad is for 15 minutes. It doesn't help you to turn it back on again for 30. What the doc is saying is wait 8 hours, wait 10 hours, 12, and then do it again and get another treatment. That's how you can get 3 in a day. Or, like
exactly.
he says, before and after a workout. If you go look at the website at redrecover.com, Hayden Hurst, tight end for the Bengals, he uses it before and after his workouts because that's how you're going to optimize it, sir, for you that you're a surfer and a tennis guy. Well, then you want to feel better before and after the workout.
Yes.
Treat it before and treat it after. That way you're loosening things up. You're getting the blood flow going before. And then after, you're also helping in the recovery process. Did I do good, Doc?
No, I was gonna say that Big O is already a specialist.
We try. We're using it ourselves. My shoulder, because I'm a side sleeper. Okay. I'm not a surfer.
Hmm.
See, that guy's an athlete. I'm just, a radio guy. So
You
I don't
dream of
move around
surfing.
a lot. But I'm sleep surfing, okay? And while I'm sleep surfing, I'm kind of injuring my shoulder a little bit. So I've been
Yeah.
using the pad every day, and now the shoulder feels great. There's no discomfort anymore and all that because it wasn't really an injury. It was
Hmm.
more kind of a discomfort type of thing. And so it's really helped out my shoulder. My wife has the same issue also, and it's been helping her out. So that's why we
And
kind
and
of
remember the protocol for an athlete. The system has to be working very well. So if you're treating your liver, if you're treating your kidneys, if you're treating your heart, you're increasing your overall health.
Yeah.
Very important.
By the way, Too Extreme is asking me, Big O, could you ask how much time does it take for a person to expect to see the benefits of Red Recover after use? My brother, 3 or 4 times you use it, you're already
Very
feeling
fast. Very, very fast.
very fast. Very fast. I can answer that because I actually experience it. Just it after a few times, you'll start to feel the difference right away. It's really flooring. And right now, 30% off. William Youngblood is asking, what about skin conditions like eczema? I think is how it's pronounced.
Yeah. Yes,
Does that
it's what we talked about. Red and infrared, very good effects for inflammation. For the skin conditions, it would be even better if you had the blue light together with it. So we have certain variations on the device that do have that blue light, and maybe he can write us an email, and then we could talk to him about that specifically.
Yeah, remember, they contact us over there on redrecover.com if you have any issues, if you have any questions, if you bought a pad and you need to, maybe get something fixed or exchanged or whatever. They are very quick and they will help you out at contact us there and send them an email, whatever questions, concerns you may have. Ed and all the great people there will take care of you right away. And that's the other thing that you're going to notice too. Not all the pads, Doc, explain to them. They're not all red lights. They're not all white lights. There are different lights for the different parts of the body and the different effects that you're trying to accomplish. So it's very important for them to tell you exactly what they're trying to accomplish so you guys can give them the right pad to it.
Yes. We are open to him, and it's actually a pleasure to try and help as much as we can.
Yep. So make sure you get it right there. Let me see. What else do we have here? Yes, 30% off is a hell of a deal right now, especially when you consider, I think the pads are already really inexpensive, to be quite honest with you, which is
We
something
wanted to make them affordable. We wanted
I know.
to have people use it.
Yeah. So check it out there if you can. Go to redrecover.com. The Doc joins us every couple of weeks to talk a little bit more about it. Doc, I appreciate you as always, my friend. You have
My
a
pleasure.
terrific week, and we will catch up again in a couple of weeks.
Yes. Thank you. Thank you very much.
Thank you, my friend. Appreciate you. Dr.
Bye-bye.
Francisco Cidral. There we go with redrecover.com. Take advantage right now. I don't know how long the 30% sale is going to last. Okay. It's been 10% the entire time, and right now you got the 30%. Make sure you take advantage of it. Big O, tell Dr. Cidral I'll be contacting out. Yeah, but you'll be talking to Ed. Okay. Ed will be the guy that will take care of you to extreme. All right, buddy. So reach out on the contact us, reach out to Ed. I already sent Ed your message. Okay. So he knows already that you're reaching out to him to extreme. Okay. So make sure you tell him, oh, sent you my text, and he'll know right away. Okay. Because I took a picture of it and I sent it to him. All right. Doctor, sorry if you answered this already, but does it help with muscle recovery? Yes, it does, Joey. That's the idea. Use it before and after your workouts. It's not only for injuries, it's not only for scars, it's not only for trying to grow your hair back. It's also for optimizing workouts. So you have normal soreness after lifting weights, after walking, running, paddle. What is it called? Pickleball, tennis, whatever it is that you do. You end up, softball. I don't care, dude. You end up with soreness. Sometimes it's in the same spot because of an old injury, an old operation, or wear and tear. That's the spot you want to treat before you played softball and then after you played softball, before you went jogging and then after you went jogging. And remember, it's a battery that's tied to it. So you can walk around the house or in the office or whatever while you're getting treatment. It's not tied to an electrical cord. So then you've got to be at a spot for 15 minutes. Now, dude, if you want to get up and you need to go cook or you need to eat and you want to treat your shoulder while you're eating, your back, your neck, you can keep doing all the things that you normally do around the house or around the office. And then when the 15 minutes are up, you take off the pad. And that's it. Super simple. They have a pad, the face pad for the ladies, for the crow's feet, for wrinkles. The red light therapy can help you out for your wrinkles. Ladies, 30% off, man. RedRecover.com. Check it out. Check it out. That's what we want you to do is check it out.